Hi, I'm Robin, Nurse Navigator at the Nebraska Spine Hospital. You typically will receive your call from the Nurse Navigator 2 to 3 weeks before your surgery. We will reach out and make the phone call to you, and we make the calls between 8:30 a.m. and around 3:30 p.m. This call is considered an appointment, so when we set up that time, we would expect you to treat it just like an appointment. And we would love for you to have a family member in on that phone call. It's actually much better if a spouse or a loved one is on the call. I always have said 4 ears are better than 2 ears for hearing all the information. And if you do have a family member on the call, just tell us their name and we can actually include them in on the conversation. During the phone call, it's a good idea to have a pen and paper handy so you can write down some important things, such as the time of surgery, the time to arrive, the address of the hospital. Also, we'll need to know your emergency contact, so know who would be your emergency contact name and phone number. And then we're going to ask you a lot of questions about your medication, so it's best to have a list of your medications in front of you, and it's even better to have your medications bottles right in front of you, so we can ask you the name, the dose, the frequency, any vitamins or supplements. We would need all that information. We're also going to ask your medical history. During our phone call, we're going to ask you if you've had your physical done by your primary care doctor. So we'll ask you for your primary care doctor's name and possibly that phone number. And we will also ask you if you are seeing any specialist doctors on a regular basis, such as a heart doctor, lung doctor, kidney doctor, or a diabetes specialist. So we'll ask for their name and possibly their phone number. During the Nurse Navigator phone call, we'll also ask you what your preferred pharmacy is and the location of that pharmacy. Thank you for watching this video, and we hope you found it helpful in how to prepare for that Nurse Navigator call. If you do have any questions, please jot them down and ask your Nurse Navigator. We would be happy to answer any of your questions.